This is the thyroid hormone synthesis, secretion and actions video. This first slide is looking at thyroid hormone synthesis, or in other words, the making of thyroid hormone. If we take a look at this diagram here, it's showing you a section of thyroid gland. Thyroid follicles are found within the thyroid gland, and they have an inner section which is called colloid, and this is a sticky glycoprotein, and then an outer section which is made up of follicular cells. Thyroid hormone is synthesized in the colloid, and then the follicular cells are responsible for secreting thyroid hormone. An interesting point to note is that under normal circumstances, there's about 2 to 3 months worth of thyroid hormone stored within the colloid. Thyroid hormones are made from iodine and the amino acid tyrosine, which is shown here. We have 2 forms of thyroid hormone, thyroxine, also known as T4, and triiodothyronine, also known as T3. It's known as T3 because it has 3 iodine atoms within the thyroid hormone. T4 has 4 iodine atoms within the thyroid hormone. It's important to note that T3 is the active hormone in target cells. Let's now look at the control of thyroid hormone secretion. We have constant neural input to the neurons that produce thyrotropin releasing hormone. The neural input stimulates secretion of thyrotropin releasing hormone. This travels in the circulation to the anterior pituitary gland and stimulates specialized cells within the anterior pituitary gland to secrete the hormone TSH, or thyroid stimulating hormone. TSH then targets the thyroid gland and stimulates release of the thyroid hormones T3 and T4. T3 and T4 then target tissues throughout the body, and there are systemic metabolic effects, and we'll look at these in more detail on following slides. It is important to note that in addition to TSH stimulating the release of thyroid hormones, it also promotes growth of the follicular cells. So TSH stimulates the release of thyroid hormones and promotes growth of the follicular cells within the thyroid gland. Thyroid hormone targets most cells of the body, so it has widespread effects, and it activates nuclear receptors. Remember that thyroid hormone is a lipid-soluble hormone that diffuses through the cell membrane and then activates nuclear receptors. If we take a look at the negative feedback, T3 and T4 act in a long loop negative feedback to inhibit TSH secretion from the anterior pituitary gland and also to the hypothalamus, inhibiting release of thyrotropin releasing hormone. Again, because thyroid hormone has widespread effects through the body, it's difficult to monitor one variable in the body and use that as a negative feedback signal. So in this case, the hormones themselves act as the negative feedback signal. Let's look at the systemic effects of thyroid hormone secretion. Thyroid hormone increases oxygen consumption. So with higher levels of thyroid hormone, we have an increased basal metabolic rate. And with lower levels of thyroid hormone, we have a lower basal metabolic rate. Thyroid hormone interacts with other hormones to modulate carbohydrate, fat, and protein metabolism. So overall, it has important influences on metabolism. Thyroid hormone is needed for the full expression of growth hormone in children, and this means that it's essential for normal growth and development, and it's especially important for the development of the nervous system. This table shows some characteristics of thyroid hormone. Some of these points have been covered previously. New points to note are transport in the circulation. Thyroid hormone in the circulation is bound to thyroxine binding globulin and also albumins. Its half-life is 6 to 7 days for thyroxine and about 1 day for triiodothyronine.